Okay. Now, ossification of the metacarpal. Primary center appears at the 9th week of the intrauterine life. Secondary center for the first will be second year. First metacarpal. Second, third, fourth will be in the 9th year. Dutoi 9th year. Second, third and fourth completes its ossification by 16th year. আর ওটা হচ্ছে 18th year. মানে the first metacarpal. Now let us try to understand phalanges. Phalanges, distal most. Basic thing you must remember, থাম্বে দুটো, বাকি চারটেতে হচ্ছে আমাদের তিনটে। আর phalanges, what is this thing is the distal most phalanges is the distal most part that is pulley shaped. আর আস্তে আস্তে একটা জিনিস দেখা যায় this is tapering. Tapering মানে এরকম হতে থাকে like a cone, right? Initially কিছু part আছে, base will be saddle shaped, concave or convex in nature. These are the few things. এই হলো phalanges. Not much of details required. Let us now have a look on the ossification of the phalanges, fracture of the metacarpal and phalanges for the sake of completion, and the side determination. These phalanges, they will start the primary center of ossification for the proximal distal middle phalanx in the 10, 8, 12th year. Secondary section, secondary center, second year, 16th year. There is something called the Boxer's and the Bennett's fracture. Boxer's fracture, first metacarpal fracture. Bennett's fracture, fifth metacarpal fracture. এই হলো fracture. Articulated hand যখন ওঠাবো, we will notice there is something called the palmar part and the dorsal part. Dorsum যেখানে আছে, dorsum মানে কি skin. So where is the dorsum? There is a dorsal and palmar. ঠিক আছে? তো এই palmar aspectটা হাতটাকে রাখবো এবং দেখবো যেন এইটা medially থাকে। তো this is the thumb. এইভাবে this is the left sided articulated hand. তাহলে side determination জিজ্ঞেস করবে আর যেটা জিজ্ঞেস করবে ossification, shape and identify the carpal bone. Articulated hand pisiformটা আসে রেডিওলজিতে, সেটা দেখানোও হয় খুব সুন্দর, ঠিক আছে? তো that is all about articulated hand. So here we are done with all the bones of upper limb. So what did we read? First day orientation class, never miss that video, clavicle. তারপরে second flat irregular bone, just like mostly like hip bone, যেটা হচ্ছে scapula. তারপরে আমাদের very common, the classical common long bone along with the femur, the longest and the toughest bone of the upper limb, humerus. তারপরে radius ulnar, hand in hand like tibia fibula, and then your articulated hand. So we have 1, 2, 3, 4, 5 and 6th bone for today. So read all the bones of upper limb together and end your osteology for upper limb. Tomorrow we come with the grand bone, my favorite bone again, which is the hip bone. We will discuss it in details. The video might be a little longer, but just try to understand the hip bone. Apart for hip bone, we'll only describe the processes, the features, anatomical position, যেটা কালকে বলবো. The next day will be the muscle attachment, fascia attachments, and the rest of the part. এই হচ্ছে আমাদের hip bone. ঠিক আছে? So in this way we continue with the bones of the infex. That is all about today's video.